structures, and some of them are discrete, some of them more diffuse. What does the brain do for us? One thing we know is higher mental functions, and we don't know everything about them, but we do know some things. So let's take a look at language, memory, brain waves, consciousness, and sleep-wake cycles. So language is the system involved in association cortex of the left hemisphere. Uh, there are numerous parts that allow us to use language. And some of the main areas would include Broca's area, which is involved in speech production. Patients who have had a stroke in Broca's area or a lesion of some other type in Broca's area know what they're trying to say but cannot physically say the correct words. In Wernicke's area is involved in understanding spoken and written words. So patients with a lesion in Wernicke's can speak, but they speak nonsensibly. They don't. They're incoherent. There are corresponding areas on the right side, and those are involved with nonverbal language skills. So here is Broca's area, where we form the words, and here is Wernicke's area, where we make sense of words. Memory is involved in the storage and retrieval of information. There are at least these 4 different kinds of memory. The one we know the most about is declarative memory. Those are facts, names, faces, words, dates, kind of things you do for your homework, for example. Procedural memories are memories of skills, so playing piano, driving a car, a lot of your nursing skills. Motor memory are motor skills, like riding a bike. And then there's emotional memories, memories that we link to an emotion. You hear something like a rattlesnake, it causes your heart to race. There are 2 stages of the declarative memory storage. First is the short-term memory, STM, or working memory. It is a temporary holding location for information. It's limited to 7 or 8 pieces of information, and that's coincidentally why, actually it's not coincidence, why telephone numbers are typically 7 numbers long. The area code, or not the area code, the local code 532, and then 4 numbers after that, because that is about what you can hold in temporary storage. Long-term storage, if you can transfer that information from short-term to long-term, has a limitless capacity. There are factors that we know, although we don't know why, we don't know how entirely, but factors that help transfer that information from short-term memory to long-term memory include emotional state. If you're alert, motivated, surprised, or aroused, you're going to have a better chance of moving that material from short-term to long-term. Rehearsal, repetition, and practice, which is why we give you homework to practice and repeat everything. Association, good ideas to try to link new information with old information. And automatic memory occurs in the subconscious. Information is stored in long-term memories. Memory consolidation helps us to fit new facts into categories we already have in our cerebral cortex. This is going to involve the hippocampus, temporal cortical areas, the thalamus, the prefrontal cortex. They are all involved in these consolidation of memories and use of memories. So we have outside stimuli from our various senses. They're temporarily stored in our cerebral cortex, kind of in a buffer. A lot of it is permanently lost, but some of it will be transferred to short-term memory. In the short-term memory, a lot of that will be lost, but some of that will be transferred to long-term memory. And if you're trying to transfer things to long-term memory, you can use excitement, rehearsal, and association with new stored data, with new data with stored data, all the kinds of things we try to do when we are teaching someone information. And if that happens, that long-term memory is there for as long as our brain is working. Damage to the hippocampus or surrounding temporal lobe structures on either side can result in slight memory loss. Bilateral destruction is going to cause widespread amnesia. There are a couple of different kinds of amnesia. Anterior grade amnesia, the consolidated memories are not lost. You still have a memory of yourself and everything you had up to that point, but new inputs can't be associated with old ones. So that person was going to live in the here and now, and they cannot have memories that last longer than about 5 minutes. Every time you meet that person, that's a new, you are meeting them for the first time. In retrograde amnesia, you lose memories from the distant past. So we know there's a lot of electrical activity going on to carry out these mental functions. Neurons are talking to each other, carrying on graded and action potentials. So that electrical activity can be measured in brainwave patterns, and to do that you use an electroencephalogram. These things are continuously going on, but there are some things about them that we know. That electroencephalogram records the electrical activity that accompanies brain functions. We can use it to diagnose epilepsy and sleep disorders. It can be used to localize lesions, including tumors or infarctions where blood strokes haven't gotten to, or preventing blood from getting to, infections or abscesses. It is also used in research, and it's part of the way we determine brain depth of a patient. It's done by placing electrodes on the scalp and measuring the electrical potentials between those various cortical areas. This is a EEG setup on a person. And over here you'll see the waves being recorded. And those waves or patterns are generated by the synaptic activity in the cortex. Each person's brainwave are unique. Those patterns will change with age. They'll change with sensory stimuli. They'll change in the presence of brain disease or the chemical state of the body. They're measured in hertz, which is a number of peaks per second. And although they are all different and there's a lot of variability, they're grouped into 4 classes based on that frequency, based on the number of hertz, the number of peaks per second. The alpha waves are between 8 and 13 hertz. They are regular and rhythmic. They have a low amplitude, so they're not very powerful. They are synchronous, and they indicate an idling brain. Beta waves between 14 and 30 hertz are more rhythmic, less regular, and they occur when we are mentally alert. Theta waves, 4 to 7 hertz, are more irregular. They're common in children, but they're not very common in awake adults. And the delta waves are less than 4 hertz. These are high amplitude waves that we see during deep sleep or when the reticular activating system is suppressed, such as being under anesthesia. It indicates brain damage if the individual is awake and still having delta waves. So here are the alpha waves. This is 1 second. Beta waves, theta waves, deep sleep. So these awake but relaxed, awake and alert. Common in children, uncommon in adults, only in deep sleep. So some homeostatic imbalances. An epileptic seizure is a torrent of electrical discharges by groups of neurons. Those groups of neurons are preventing other messages from getting through. Again, this is not a victim. This is a patient. A patient of epilepsy can lose consciousness, fall stiffly, or have uncontrollable jerking. Epilepsy is not an intellectual impairment. Nothing wrong with the intelligence and the ability of these people to process information. It's electrical. It occurs in about 1% of the population. Genetic factors play a role. Brain injuries can lead to epilepsy, strokes, infections, and tumors can also cause epilepsy. Uh, Often people who have epilepsy have an aura or a sensory hallucination that may precede the seizure. Sometimes it's smell, sometimes it's colors. There are two basic types of seizures that used to be called petit mal and grand mal. The absent seizures, formerly petit mal, is a seizure of young children. Expression on their face goes blank for a few seconds. They look pretty normal, but they're really not there. They're not receiving and getting information. They're not processing information for the length of that absent seizure. The tonic-clonic seizure seems more severe. It can last a few minutes. These patients lose consciousness. They can break bones, lose bowel and bladder control. They can have severe biting of the tongue. But in general, when someone is having a tonic-clonic seizure, I have been told to just make sure they don't bump into things on the floor, time the length of that seizure. Do not try to put anything in their mouth to control them biting their tongue. So control of epilepsy includes the use of anticonvulsive drugs. We also experiment with vagus nerve stimulation, deep brain stimulator implants that deliver pulses to the vagus nerve, directly stabilizing brain activity. Bringing us to consciousness. Consciousness is very difficult to explain. It's very difficult to tell what consciousness is. It's very easy to tell unconscious, but it's harder to describe consciousness. But we do know that consciousness involves the perception of sensation, the voluntary initiation and control of movement, capabilities that are associated with higher mental processing, including memory, logic, judgment. It is clinically defined on a continuum that grades behavior in response to stimuli. There is alertness, drowsiness, stupor, and coma. There are suppositions on how consciousness is created. We know, however, that it involves the simultaneous activity of large cortical areas, that it is superimposed on all the other neural activities, that it is entirely holistic and totally interconnected. It seems to be an emergence phenomenon, that it's almost that it's more than the sum of its parts. So, except during sleep, loss of consciousness signals that the brain function is impaired. A couple of examples of that would be fainting or syncope, which is a brief loss of consciousness. That's most often due to inadequate cerebral blood flow. It could be due to low blood pressure or ischemia from a hemorrhage, or sudden and severe emotional stress. The other is a coma. Coma is unconsciousness for an extended period of time. Coma is not the same as sleep, not the same as deep sleep. The metabolic changes, such as oxygen consumption in the brain, are lowered, so it's really not just sleep, it's loss of consciousness. Brain death is an irreversible coma. There are ethical and legal issues that surround decisions on whether a person is dead or alive. I would just tell you that, like everything we've talked about this year and everything you should know, death is a process. It is not a single event. It's a process. Sleep-wake cycles. Sleep is a state of partial unconsciousness from which a person can be aroused by stimulation. During sleep, cortical activity is depressed, but the brain stem doesn't really change. There are two types of sleep, and they involve are defined by EEG patterns, and they are called the non-rapid eye movement and the rapid eye movement. NREM sleep is broken into 4 stages, and REM sleep. So we pass through the first 2 stages of non-rapid eye movement during first 30 to 45 minutes of sleep, and we move into stages 3 or 4, and 4, which are referred to as slow wave sleep. As we do that, the frequency of waves is going to decline, but the amplitude of those waves is going to increase. Our EEG will change, heart rate, respiratory rate, blood pressure, GI motility will all change. At about 90 minutes in, the fourth stage ends and REM sleep begins abruptly. There is temporary paralysis during REM sleep, except for rapid eye movements. Oxygen consumption, heart rate, breathing increase, and those increases can be even higher than they are when we're awake. And most dreaming is going to occur during the REM part of sleeping. So we have awake, REM, stage 1, stage 2, stage 3, and stage 4. Relaxation begins. EEG shows alpha waves, irregular EEG with sleep spindles. Sleep deepens, dominated by delta waves. Hard to wake someone from this. This is when bedwetting, night terrors, sleepwalking might happen. And then you cycle back to REM, and when all the skeletal muscles, except for the eyes and the diaphragm, are actively inhibited, and this is when we dream. So how is sleep regulated? It's regulated by alternating cycles of sleep and wakefulness that reflect our natural circadian rhythm. They're going to say 24 hours here. I don't think that's correct. I think the actual circadian rhythm is closer to 22 or 23 hours. But irregardless, it cycles through a natural rhythm. The reticular activating system activity is inhibited while we are asleep, but it is also involved in mediating the stages of sleep, so it's not entirely turned off. The suprachiasmatic and the preoptic nuclei of the hypothalamus are there to time sleep cycles. Hypothalamus releases proteins called orexins that help the cortex to wake up, and a typical sleep pattern alternates between REM and non-REM sleep. So here is awake, go REM, down to stage 4, and you start back up and cycle, getting a little less as you go, till about 7 hours, typically you wake up. So the importance of sleep, we don't know why sleep is important, but we do know that sleep is important. There are lots of possibilities out there, lots of theories. Slow wave sleep, 3 and 4, is probably a restorative stage. People that are deprived of REM sleep become moody and depressed, and for that reason we think REM sleep might give the brain an opportunity to analyze the day's events, work through emotional events or problems, might eliminate the unneeded synapses that were formed during the day. Are those who believe that we dream to forget. Our daily requirements decline with age, and stage 4 sleep declines steadily and may be gone by the time you reach the age of 60. Clinical imbalances. Narcolepsy is a sleep disorder that involves an abrupt lapse into sleep from a wake state. Cataplexy is a related condition. A person can lose muscle tone while they are awake. Those orexins we mentioned from the hypothalamus, the wake-up chemicals, probably destroyed by the patient's immune system, and orexin replacement is one possible therapy. Insomnia is a chronic inability to obtain the quality or amount of sleep needed. It can be caused by a number of things: depression, anxiety, overuse of caffeine, computer, cell phone too close to the bed, and that might be treated in the future with orexin blocking agents. Okay,